Hey everyone, thank you so much for joining the Behind Company Lines podcast. Today we have Dan Goldsmith, CEO of Tendo. Tendo is a software company focused on seamlessly connecting patients, clinicians, and caregivers throughout the care cycle. Dan, it's so exciting to chat with you, not only because of your wealth of experience building startups, being around startups, but also what you're doing with Tendo, which is, I think, tackling a huge problem in at least the healthcare industry, which is the connection thing, finding patients, the right care providers, helping providers not only acquire new patients, but even retain them and figuring out the best way to connect those two when, it's been fairly fragmented as people move and change in all different ways and life changes and things like that. There's oftentimes becomes more and more barriers to connecting those two when there's obvious incentives on both sides to offer care, receive care, distribute, and all those things alike. But before we get into Tendo, what were you doing before you started the company?
Yeah, sure. So Julian, first off, thanks for having me here. Really excited to spend this time. You're very high energy, so I'm looking forward to a good engaging conversation here. But I think your question was, what did I do before Tendo leading up to that that sort of influenced my career? Just real quick, and I know we'll get into more details. I've been super fortunate throughout the last 25 plus years to have amazing opportunities and incredible mentors. And as an entrepreneur, by the way, I don't know when someone's considered a serial entrepreneur. Is it like 2 times, 3 times? I don't know. But anyways, throughout my career, one of the things I've learned is focusing on both difficult and important problems was part of my ethos and part of my personal mission. So I've spent my entire career focused on industries like life sciences, education, and now healthcare. And if you look at part of the common thread across each of those industries is not only about innovation and technology, which has been an important thing, but more about how can we make an impact on people's lives, right? In the case of patients, students, teachers, clinicians, the people we all have in our world in some way, shape, form, or another, working tirelessly and effortlessly to try and help us out. So there you go.
Right. It's so fascinating thinking about where you've been able to kind of spread your impact. And really, another common thread I see is it's heavily influenced by institutions and really large organizations, whether it's students, whether it's patients in healthcare. And what's been interesting around navigating, say, an environment that maybe has a lot of blue ocean in front of it, but it kind of has these fairly structured bounds in terms of institutions that have been doing it for a while, legacy technologies and things like that. How I've been able to kind of bring in new technology or new solutions, new innovation into a kind of almost I guess, industries that are really kind of legacy and prescribed and have all this infrastructure and things around it.
So there's a few things I've learned along the way. First off, was learning about myself and recognizing, even from when I was a kid, when someone would say something is really difficult or impossible, I would obsess over that thing until I sort of figured out an answer. So you have to be a little bit crazy and very persistent to be taking on what you're referring to as large-scale complex problems, right? The other thing is when you look at industries like healthcare and education, life sciences, these are regulated industries, these are large industries, they have lots of moving parts, and to your point, there are many legacy practices and infrastructure components that in many ways, in theory, should enable innovation and growth and change, but in practicality, they are an obstacle to growth and change. And especially in industries where these are so connected to sort of outcomes on people and critical outcomes, you have to be very careful with change as well. Now, technology to me in these industries, I believe needs to be a supporting player, not a star player, right? There are incredible humans every day that are working to take care of us in these industries, and I'm a fundamental believer in technology should be superpowering humans, and that's the right role for technology in these industries. However, there are some elements that provide headwinds to change and innovation, right? An example of that is many of these industries use regulations or refer to regulations as an excuse for not innovating, right? That fear of risk aversion. Many of these industries act in what I call a pack mentality. They're afraid to change unless everyone else changes at the same time. So when you have an environment like that, it's very hard to see these moments of change. Now, interestingly enough, we're in a really unprecedented period right now for healthcare. There are financial pressures like we haven't seen ever before. There's what I refer to as the COVID hangover, where we're still dealing with COVID, but healthcare will continue to deal with that hangover from COVID for years, if not decades to come. And when you hit a moment in time like that, it actually is a driver for innovation and change. It causes people to move from the status quo. So those are some of the elements and drivers of change, and technology can be a big part of that, but it's not the only part.
Yeah, and thinking about the ways in which when you break into that pack mentality, and what are the ways that an initial partnership is so valuable and not only learning about your product, but also doing good work and expanding that partnership, breaking into industries that have a high barrier to entry, being that they kind of know each other. It's almost like a club in a sense, and it really is difficult to not only change one person's mind, but kind of influence the pack there. How important is that initial partnership, and how much are you kind of working with them to build your product and to then adopt into other businesses alike or other institutions to be able to service your customers?
Yeah. So the first fundamental challenge with that is there's this misperception that change happens in these big bang moments. When we talk about industry and global change, it actually is a spark that ignites the fire that drives that change over time. And so we get asked a lot. We were like, well, Dan, you and your team are taking on a really big, audacious, challenging goal. I don't think healthcare is going to be able to change like that. And I always tell it, actually, I don't expect all of healthcare to change like that. What happens is you work with one or two or three or five of the early adopters who share a similar vision, have a reason for change, and are committed to that in a meaningful way from leadership, both internally and externally. And as those first five demonstrate the not only just feasibility, but the benefit of new ways of working and operating, that will de-risk it and inspire for the next 10 and the next 10 for the next 50. And at some point, you've created the momentum that will drive change at industry scale. So that's the first thing you need to consider, is that like any change, you look at large systemic change with something like Uber. Uber didn't just happen overnight. These things happen over a protracted period of time. So you need to be persistent, you need to be patient, you need to stand by sort of the ideals and the vision of what you're creating. And you need to also recognize that change from A to B never happens in a straight line either. You're going to bump around a little bit on the way.
Yeah. And thinking about Tendo, what was the initial inspiration behind the company? You were coming from different industries and then moving into healthcare. Kind of walk me through the journey. What was the problem that you were seeing, and what made you decide to tackle it?
Yeah. So about 3 years ago, myself and a whole host of other people, by the way, I've worked with my sister, Jennifer Goldsmith, for the better part of the last 25 years. And so I've had the pleasure of working with family, which can be both stressful, but it's a lot of fun as well. But what we did is we actually assembled what we call a founding team. And the inspiration initially was the recognition that consumers of healthcare have a very different experience in healthcare than consumers in just about any other industry. So when I look at my finances, I can see my entire financial health at a click of a button, but for the life of me, I can't do the same thing with my personal health, right? And arguably my personal health is the most important thing. So as we started pulling at these threads, we started identifying more and more the deficiencies in the experience we have as consumers in healthcare, and seeing the parallels in other industries where the consumer experiences, the frictionless navigation, the way we as consumers consume information, services, and access and translate information is so easy and has become the norm. Why can't we apply those same methods and technology and techniques? Now, what we did from there, Julian, is we went on a listening tour. Generally, we have a philosophy. If your gut says no on something, trust your gut. If your gut says yes, do your homework. And so our gut told us that there was an opportunity and it was time for fundamental change in the way that people consume healthcare in this country and ultimately beyond. But we wanted to do our homework to not just make blanket assumptions. We wanted to study healthcare. We did it for about a year in why. Why hasn't technology and consumerism taken hold in healthcare like it has in other industries? So we spent the first year of the company with that founding team on a listening tour, talking to as many healthcare systems, executives, doctors, patients that we could get our hands on.
Yeah. And thinking about on that journey, what were some things that you uncovered? And particularly, I think what's really important is like the incentive structure for, especially with the marketplace. Like, what are the incentives for both? And it seems as though fundamentally patients want to get cured, providers want to provide care. So why is there so much friction in that connection process? Where does the incentive structure break in regards to how maybe the environment or the ecosystem is set up? What did you kind of uncover along that journey around topics like that?
Yeah, that's a big question. There's a lot of things that we had covered. I think first and foremost, let's start with what you highlighted. There are very genuinely good intentions and fundamental passions for taking care of people that exist within the core stakeholders of healthcare, right? Patients want to get the best care they can and have good outcomes. Physicians feel it's part of their mission to take care of people, and they drive a lot of satisfaction out of that in their career. And healthcare systems ultimately feel beholden to the mission of taking care of people. However, we live in a world where financials have great influence. We live in a world with regulations. Healthcare systems in this country, especially many of them being not-for-profit, operate in a world where they don't have pricing control. They don't have margin control. As inflation has gone up over the past 6 months or so, the material goods for hospitals has gone up, but they still can only charge the same things for the same procedures and interactions. So you have an economic model that makes it challenging to drive alignment with stakeholders. The other thing that we have in healthcare is there's been a focus and emphasis and maybe a manipulation, if you will, or a mutation of what the healthcare record and transparency is. So a couple of decades ago, the government said, hey, we need to move to electronic healthcare records. And so there were a number of solution providers and technology providers say, hey, we need to provide systems to be able to track and manage an electronic health record for patients. Unfortunately, that morphed into something that was more oriented around revenue cycle management and billing than it was for truly creating transparency, access, and interoperability wrapped around patients. So one of the things that we're working on is saying, how can we put the patients and the clinicians back at the center of the equation, recognizing that there are still financial realities of operating a healthcare system in this environment.
Yeah. And how do the kind of the change in, I guess, the goals, why is that so nuanced in terms of, I think what's super popular, at least with a lot of software companies and companies within the last 5 years, is focusing on the user experience, and that pretty much drives revenue, right? Retention, making your customers happy. It's all this philosophy, but why is it different in healthcare than in these other industries? Is it because of the systems in place? Is it because of all the other kind of factors that they're bombarded with externally as a provider? Well, what doesn't allow them to, or even the technology companies building software for these practitioners and all these records, why aren't they building towards the user, and why have the incentives gone to a financial model? I'm sure that's not that wasn't their hypothesis, or that wasn't their motivation. But why is that?
So I think this is where healthcare has been a laggard in evolution of the industry. Other industries have become digitized and virtual, globalized in a way where healthcare is still a very localized industry, right? If I need to go and get at least in today's day and age, if I need to go and get a hip replacement, I can't do that online. I can't do that over Zoom. I mean, Zoom's good, don't get me wrong, but I don't think they're doing robotic surgeries through my monitor yet. But, so effectively, healthcare is operated around a more monopolistic or duopolistic real estate model. So if I'm a healthcare system that exists within a catchment area of zip codes, I sort of operate historically believing that as people need healthcare, I'm going to get some portion of that demand, and that's my customer base. So the priority on making the patient experience better or more consumer grade hasn't been a priority. The priority has been more on how do I maintain financial stability? How do I increase and bill in an accurate and complete way? And how do I manage effectively my relationships with payers in the community to maximize my payer mix? So that's what's changed, or is changing fundamentally, is the healthcare industry writ large is experiencing a new era of disintermediation, where the financial models of the past are not sustainable. Healthcare systems can't acquire their way out of this problem, And with more than 50% of healthcare systems this year expected to be less than 1% or less than 0% margins, you have the impetus to change that's necessary. And there's a renewed focus on how that patient experience can correlate into more demand, more activity, and a different financial model.
Yeah. And with the change in the financial model, what does that mean in terms of like the construction of a healthcare company and business? Say, obviously you have the provider, you have the doctors, they obviously have the bulk of the work and the nurses. So there's a lot of individuals, not a moving parts, but in terms of like patient acquisition, what's like the previous like structure in terms of acquiring new patients, and how is changing the financial model kind of, is that having any change on the teams that providers are having at healthcare companies in focusing on acquiring new patients? Have you seen a change in that at all?
I have. There's a few key themes that have come into play. One is this idea of hospital at home. So if I can serve individuals and patients in a better way at their home or in between their home and the hospital, then I'm going to bend the cost curve in terms of how I service and drive outcomes, health outcomes. Secondly, is there's a growing swell of demand around better transparency of information. So patients and caregivers and clinicians, for that matter, have more agency in making and information in making healthcare decisions, right? I imagine, Julian, probably you and your family make decisions in the way that myself and my family make. If I have a healthcare issue, then I'm probably trying to go to that doctor that we've known and loved all of our lives, those people we know and trust. There's a lack of information that's allowing us to make informed decisions as consumers, right? So I don't know if I'm getting an appendectomy, like I don't know whether I need like the world's best surgeon out there, or whether pretty much any surgeon who passes the minimum is probably just as good as anyone else. So we need to rewire the supply and demand curve to bend the cost equation in healthcare, and that will open up capacity, and that will change sort of the load balancing across the healthcare system as well. And then the third thing is really the digitization of the healthcare environment. How can we use data and information and digitizing that experience to reduce costs, streamline that experience, and be much more precise in the medicine and therapies that we're delivering to drive outcomes for patients in a much more efficient and effective and cost-effective way.
Well, something that fascinating that kind of inspired me right now as you were chatting was kind of coming up with an average for, say, a procedure and then measuring doctors or providers on that average and seeing, like you mentioned, if you need somebody who's extremely excellent because it's a fairly difficult procedure, or if an average surgeon, I don't want to say an average surgeon, but somebody who practices it frequently and doesn't necessarily specialize can complete that procedure. How do you do that when, kind of the insights to not only I guess practices and which provider you go through can have a huge impact on the patient, and almost like, for me, I feel like, is it a liability risk if you offer some insights and incorrect decisions made? How do you kind of cater to the high, I would say just like the high risk environment of offering bad information?
Well, I think it's not about good or bad information. I think it boils down to accurate information, right? Any patient should be able to see any provider, what procedures they've done, what the outcomes have been. Have they resulted in mortality, infection, readmission, resurgical rates? What should they be? And then I should also be able to look at certain demographics and other filter criteria to say, hey, if I need to get a knee replacement, what are the physicians in my local area who have operated on patients similar to me, and what outcomes have they had? And then I need to understand, like, what is the risk profile of different procedures, right? I think, like, you and I probably, like, if we were getting, I don't know, an MRI or an X-ray or whatever, we probably don't think twice about who's administering that X-ray, right?
Right.
But if someone is doing a knee surgery, that we're going to be a lot more critical about. I had one quick story. I had a real story about 15, maybe more years ago. My appendix became infected, right? So, by the way, I'm going to give you some Dan Goldsmith PHI here, so it's all good. I give permission, but so my appendix was infected. I had a bad stomach ache. I went to the ER. The ER was like, Mr. Goldsmith, your appendix is infected. We need to have your appendix out. Now, I had no idea what was going to happen. I called my wife. I started freaking out. I'm writing goodbye letters to my family. I'm like, oh my gosh, I'm going to go under the knife. This is going to be horrible. I don't know how I'm going to survive. I call up a doctor. I'm not going to give the name here. This doctor was like head of the American Cancer Society, one of the top 10 rated doctors in the country. I said, doctor, please, I'm about to go under the knife. They're telling me surgeon ABC is going to do the procedure. Do they know what they're doing? Am I going to survive? Now, I'm pretty sure, like, Dr. Superstar said to me at the time, he said, Dan, hold on for a minute. I'm going to go look into a few things. I'm pretty sure he put the phone down, ate a sandwich, came back and said, you're going to be just fine, right?
Yeah.
That's all I needed to hear. All I needed to, hey, Dan, you're going to be just fine. So the moral of the story is, if we can empower consumers and others with information, we can trust consumers to make informed decisions, and those decisions will rewire that supply and demand. So we know that the criticality of having the top surgeon for an appendectomy is not nearly as critical for having the right surgeon for me for a knee procedure, a hip procedure, or a cardiac procedure.
Yeah. And thinking about, obviously transparency is hugely popular, and a lot of companies are even throwing transparency into their pricing, to their business practice in terms of their values. But healthcare is different because of the information so critical and just somebody's personal kind of well-being and life and things like that. How do you think about transparency and in offering that between providers, with patients and providers? And what are some of the things you have to consider that normal companies don't when thinking about distributing and having transparent private information?
So look, I mean, this is not a new topic. I think companies need to not be afraid of navigating privacy and security. There's well ingrained mechanisms and methods to be managing privacy and security of data and information, right? And that's not to say every once in a while we see in the news a server falls off a truck or someone gets an information. But in healthcare, there's a couple things that need to happen. First, there needs to be much more of an interoperability information highway, so the people relevant to the care journey of an individual can have access to that information in a much easier way to make informed decisions and recommendations. Secondly, is we need to trust patients to be part of that equation. So it's less about data security and privacy. It's more about what I refer to as sovereign identity management. How do I, as a patient, become the traffic controller of where my information is, understanding what my information and health history is and how it is shared, right? So we need to put that control and agency back in the hands of the patient and their loved ones, and they can have more control over how that information is connected. But that doesn't exist today. It's a great opportunity for a company to tackle. There's some good companies out there trying to do it. Tendo is not trying to do that piece of it, but we hope that someone can help tackle that problem across the industry.
Yeah. Tell us a little bit more about Tendo in terms of what's been exciting about the traction you've seen up to this far, how many users are on the platform, how many providers, what are some really cool and inspiring stories that have really kind of motivated you to continue, but also what's the next phase of growth look like for you?
That's great. So we started in earnest about 2 years ago after our listening tour, and we're really excited about where we are. Now, there's some unique things in the way we started the company. We're still very early stage. And there's some unique things in the way that we built the company. First and foremost, we wanted to build an amazing team, a team that's a combination of what we call Silicon Valley DNA and healthcare expertise. So some of the best and the best from the technology industry combined with the best and the best of the healthcare industry that really have a vision towards change. Secondly, we wanted to put capital fuel into the company in a way that allows us to pursue an ambitious vision over a long period of time without having to take shortcuts, make mistakes, take side avenues, and really maintain a focus on that long-term vision. So we partnered with a couple of VCs, General Catalyst and Lux in particular, and we put about $70 million on the balance sheet early on in the company. We also have what we call this sort of strategic customer or foundational customer model. So what a lot of technology companies do in the early stages is they will build a small product and try and get a lot of customers and to get revenue flowing. So what we've done is we've very deliberately chosen a handful of healthcare systems to work with exclusively in the early days of us building products and the platform. So our first product is focused on enabling patients to navigate the care journey end to end. We go well past the digital front door. So whether a patient is seeking, scheduling, engaging, or following up in care, we're able to help that patient navigate healthcare across providers. Secondly is we're building out capabilities for patients to navigate complex care journeys. So it's not good enough just to have like filling out forms and scheduling appointments. How do we help a cancer patient navigate care, an orthopedic patient, a heart patient? And then the third thing, Julian, probably one of the most important and integral parts of our mission is we recognize that data and information is an important piece of solving this problem. So we've built a whole data and analytics enterprise to build what we call Tendo Insights. And those insights are driving things like empirical care journeys and helping to guide what is the personal care journey that makes sense for Dan, and having that surface itself to both the patient and the clinician. So we're working with about 6 or 7 organizations right now very closely. We don't talk about their names. We'll be doing some announcements soon. We have made some announcements in the past. But we have customers live on our platform. We have our data enterprise up and running. And over the next 12 to 24 months, we'll continue to work with those early customers and bring on a few other early customers, and then go much more broader into the industry. But we wanted to work with strong focus to prove a new model before we went too broad.
Yeah. Thinking about whether it's external or internal, what are some of the biggest risks that Tendo faces today?
So, in terms of the biggest risks, we live in an environment right now in healthcare where there's lots of pressures. There's economic pressure. There's never been a time that I can think of where healthcare systems were required to show near-term economic ROI to support anything they're investing in. So historically, when you look at the patient experience in healthcare systems have done the best job they can, despite the fact that technology has been fragmented and disconnected, right? Healthcare systems haven't had a role or a consolidated view in the organization around a patient experience, and that needs to change. And then third, healthcare systems haven't typically correlated improvements in the patient experience with economic outcomes and ROI. So what we need to do is we need to draw connections to the fact that if you improve the patient experience, you'll reduce no-shows. Patients will be better prepared when they show up for appointments. You can reduce readmissions. You can identify patients with high acuity that have a higher need for intervention. And all of those things are great for patients, but they also drive economic outcomes for healthcare systems. So that's probably the biggest challenge we face right now, is just the pressures in the marketplace influencing the things that we need to bring forward in our roadmap and our emphasis to make sure that we can not only achieve the vision we've set out to achieve, but address the near-term and acute needs within the healthcare systems today.
Yeah. I was going to say, long-term wise, what's the long-term vision if everything goes well, what's the long-term vision of Tendo?
Yeah, I mean, when I talk about Tendo, what we're trying to do is build an enduring company that's having a really positive impact on people's lives and being a great place to work. So that's the first thing we think about. The way we measure success is, are we creating a better experience for patients, and is it driving better quality outcomes and clinical outcomes? So we'll continue to measure ourselves with that. But over time, when we look over the long term, our goal would be that there is now a pervasive and more ubiquitous access point and navigation landscape for patients in healthcare. Patients can navigate a marketplace of healthcare and environment of healthcare where they have control over their own information. They can make informed decisions, and the journey of getting from sort of cause to outcome and beneficial outcomes is much shorter and more confident and less anxiety ridden than it's ever been before.
Yeah, I love that. I like this next section. I call my founder FAQ. So I'm going to hit you with some rapid fire questions.
Let's do it.
And then we'll see what we're going to get. I always like to open it up with this question. What's particularly hard about your job day to day?
What's particularly hard? Oh, it's supposed to be rapid fire. Hard about my job is I don't get to interact with employees and customers nearly as much as I would like to. I would spend 100% of my time doing that all day long, and there's just sort of necessary things that need to be done that prevent me from spending focused time in that way.
Yeah. What was something that you spend too much time on that you would like to spend less, and then little time on that you would like to spend more?
The financial stuff. There's a lot of budgeting and reporting and compliance things, and it's all necessary. It's all important. My job as a CEO, I actually, I don't want this to be oversimplified, but My job
Sure.
as CEO in many ways is about setting direction and removing obstacles, right?
Yeah.
If I'm doing my job well, then we've assembled an amazing team. My sister and I, as leaders of the company, our job is to assemble an amazing team, set the vision, and then remove obstacles to be able to get those things done. So that's where we spend the majority of our time.
Yeah. But thinking about working with, I'm the oldest of five, so once everybody else grows up, I'm sure that there'll be some relationship in terms of businesses. But for those, who do kind of navigate familiar or even close friendship relationships and founding relationships, how do you segment business from personal relationship, but also how do you clearly communicate and set expectations on what each person's good at, and also where your responsibilities lie for the benefit of the company, being that the company's kind of the most priority, I think, focus of both of you. How do you kind of set those boundaries? Yeah.
Look, I think first of all, you need to understand that you can't have any ego or insecurity. There's no
Yeah.
agenda. And by the way, that's for anyone who wants to be close on a leadership team and teams in general. But when it comes to family, there's no one you want to let down. Like you'll work harder
Yes.
and be more dedicated. The last thing you want to do is let down a family member. And so
Yeah.
that dynamic can work really well. What Jen, my sister Jen and I do is we are very open about each other's strengths and weaknesses. We know the areas and are very clear in our communication around where we divide and conquer. We also
Mhm.
are each other's primary advisors, so we consult each other and recognize without any ego or insecurity areas where we can ask for help. And
Mhm.
knowing that in many areas, when we combine forces and collaborate, it's going to come up with better solutions. And when it comes to the dinner table, we don't talk about work. That's a
Yeah.
very important thing. I think we drive all of our families crazy if
Yeah.
we talk about work a lot. So just knowing how to put work down, enjoy family, and having that personal time is important.
Yeah. Yeah. I always think, shifting back to Tendo and the platform, what are some of the, obviously you're working on these insights that are driving ROI for providers out there. What are some surprising insights that you maybe didn't hypothesize or didn't expect, or maybe these companies weren't really, had the expectations that something was going to be either positive or negative, be impacting their business? What are some surprising insights you've seen kind of throughout this journey?
Yeah. So one of the areas where we do a lot of work with insights is around how quality is measured in healthcare, right? And we
Yeah.
look at quality rankings and ratings within healthcare. There's lots of systems like US News and Leapfrog and CMS rankings and others out there. And so part of our insights tool really decodes those things and understands that at a deeper level than many others. Some of the surprising things is how disconnected those quality rankings and outcomes can be
Yeah.
from what information is important in making decisions. So, for example, one of the quality rankings around orthopedics, you can look up online what's the top orthopedic department in the Philadelphia area, let's say. What
Hmm.
many consumers don't know is those rankings in one of these particular systems is based exclusively on wrist and spine procedures that have nothing to do with hip or knee procedures. So if I'm
Really?
looking for an orthopedic requirement because I need a knee replacement and I'm looking at these rankings, they actually have no correlation. So it's those types of things that are always surprising to me. I think the other thing is when we look at insights in this industry is the nature of data and information and the algorithms that are used to determine quality, outcomes, financials, and others can be very complex and convoluted. And when you start decoding them, they don't necessarily depict the reality that you would expect, like the hip and knee procedures, for example.
Yeah.
That goes into health equity is a big challenge right now. How do we look at and measure and understand equity and access within the healthcare environment? There are no good metrics right now that help us understand true health equity within this country. And
Yeah.
what do the environments look like in different cities and different environments? How do healthcare systems best support equity?
Yeah.
We can see that in the disparities in outcomes that happen within this country, but the data is still relatively opaque to help lead us to the answers to how we solve these problems.
Yeah. Obviously, because it's popularized now with ChatGPT, we've got to talk about AI, artificial intelligence, ML, machine learning, and things like that. I'm just adding all the buzzwords so the transcripts to pick up on SEO. But anyways, how has this type of technology kind of impacted your company now, and what's been exciting about new developments in these, whether it's machine learning models or tools that have some kind of AI component? what's particularly excited about integrating new advancements in it that you think would be benefiting your company, if there's anything?
There's a lot. Machine learning has become woven into the fabric of most tech companies right now, most industries in one way or another. Machine learning can be very simple, it can be very complex, but the premise of machine learning and AI really is about iterative pattern recognition and looking at large scale information to help inform decisions, drive precision, and create automation, right? So AI and ML sit at the center of industries like robotic process automation, sit at the center of new paradigms of marketing and growth marketing and understanding data at large scale. They sit at the center of customer support and automated interactions and AI bots. And in healthcare, we're starting to experiment about what AI can do. There are companies, we're doing some work with a company called AI Doc right now. They're using AI to interpret medical images. And they can catch things on medical images that can be really important in terms of the care of patients and identifying things. So AI is another tool I view in the toolbox that can help superpower humans, get us to the right answers faster, and automate tasks that have higher precision and higher efficiency. So we're building that into some of the Tendo tools. We use machine learning within our insights to simplify work, get it more precise answers, and find patterns that maybe we wouldn't see with the human eye.
Yeah. It's good to see the impact in the little ways that could really drive ROI in your own internal business and really drive those insights for customers. And it only becomes better and better as you use it. But yeah, it's exciting to see what those advancements will have in terms of their impact. I always like to ask this question because I love how founders extract knowledge out of anything that they ingest. So whether it's early in your career or now, what books or people have impacted and influenced you the most?
Yeah, Innovator's Dilemma is one of my go-to books. I think that's something that every individual, every business person should read. Just my inherent nature is to always question and sort of break things so we can build new and figure out new ways of doing things. It's effectively the innovator's dilemma. If you look at the S&P 500 right now versus 60 years ago, I think there's now less than 5% of brands on the S&P 500 that were 60 years ago. So there's a reason why they've not survived over the last 6 decades, and the primary reason is the innovator's dilemma. They've been afraid to disrupt their own innovation. So that's something I always keep in mind. Another important book for me is Dan Heath's Power of Moments, right? There's a great story about the Magic Castle Hotel, I think it is, in Los Angeles, being one of the top rated hotels. And really the premise of it is about how do you create these delightful, unique moments, and the power of those moments in creating affinity and loyalty and trust to brands, to organizations, and other things. They're the unobvious things. This hotel has a popsicle hotline where you can call poolside and you'll have an individual in a tuxedo come forward and give you popsicles, right? So to me, I love the unobvious things. So another book of mine that I like to cite as well.
I love, the unobvious things is really cool because it's like the experiential component that really ties an experience to a brand, which the popsicle thing is hilarious, but I could see it's like an obvious takeaway. You come away with that product, and in an obvious moment, you could tie, with an experience from a different user. So I love that. That's super cool. And an innovator's dilemma, that's fascinating because I guess disrupting your own innovation in a lot of ways is where a lot of companies maybe kind of stop progressing forward. Some companies are extremely good at it, and other companies kind of miss on that.
And I think this is especially relevant to the healthcare environment right now, where change and innovation is necessary. However, so many companies, what they'll do is they'll say, hey, this is the main thing we do and we've done for years and years. If we're going to try something new, it's going to be done in like little bursts on the side, rather than institutionalize innovation the way we do things all the time and reward innovation, right?
Yeah.
That's why organizations like Amazon and Apple have really succeeded and thrived over time. They've been willing to question the status quo and build confidence and persistence in their pursuit of new ways of doing things.
Yeah. I know we're coming up to the close of the episode here, so I want to make sure that we didn't leave anything on the table. Is there any question I didn't ask you or anything that we didn't talk about that you wanted to kind of touch on right before we leave here? Anything left on the table, Dan?
We're at an interesting time as we talk about entrepreneurship and starting companies. We're at an interesting time. I'm sure a lot of your listeners are thinking about, oh my gosh, what do I do in this environment right now? The economy has gone through all these fluctuations. How do I raise money? How do I connect with the VCs? How do I think about starting companies, we've seen these massive fluctuations. What I always like to share with people is say, go back to the fundamentals, right?
Yeah.
There's such a thing as good money and bad money. Focus on those fundamentals and good discipline. And this is not a sprint. It's a marathon when you're starting a company. And again, put that ego and insecurity at the side. You need to give yourself time to trust your gut and then do your homework. You need to go out there and sort of learn and iterate and course correct. And so I think that's no more important than it is now for entrepreneurs and when you're starting companies. I think the hardest thing for companies and entrepreneurs and founders to do is to recognize when their original idea wasn't necessarily, quote unquote, the right idea. And so the most successful entrepreneurs that I've seen are ones that recognize when they need to course correct, and absent perfect information, they're willing to make decisions. So I talk a lot about that with people, but that's one of the things we haven't touched on.
I love that. I love that. Dan, it's been such a pleasure not only learning about your background, your experience, but also what Tendo is doing and how you're impacting your customers. Last little bit is for our audience, where can we support you? Where can we find you? Where can we be a fan? Give us your plugs. What are your LinkedIns, your Twitters? Where can we be not only a support of you, but also of Tendo?
So yeah, thank you, Julian. Really appreciate it. Look, we're a community for change in healthcare. So when you look at the health tech industry and the broader healthcare industry coming together, expect greater than what we've had in healthcare. Question why things are the way they are, and work in collaboration as a community to elevate change within this industry. Don't be selfish, because it's not going to be one company that is the star company that changes healthcare and changes the dynamic for patients, clinicians, and caregivers. So go to www.tendo.com. We're on a mission to connect patients, clinicians, and caregivers in a frictionless and seamless way and evolve and change that experience, but we can't do it alone.
Amazing. Dan, it's been such a pleasure not only learning about your experience, your background, but also what Tendo is providing. And I hope you enjoyed yourself today. And thank you so much for being on Behind Company Lines.
Yep. Julian, this was super fun. Thanks for having me.